Hi, today I'll be talking about the effects of prayer and meditation on the healing process for patients. First, I'm gonna begin um, defining meditation and prayer, and these two techniques have been used for many years, and they're being shown to help the human body in many ways. As stated in the book in the article called "The Potential Health Benefits of Meditation" by Cynthia Allen, who is a assistant professor in the Department of Exercise and Sport Science at Carthage College. She mentioned that even praying involves meditation, the other way around is not possible. What I mean by this is that meditation might not necessarily involve praying when practiced. However, meditation has its root in religious practices and Buddhism philosophies. Praying has the same positive effects on the human body compared to meditation alone. For instance, both can help lower blood pressure, increase awareness, deal with chronic pain, helps to keep good sleep hygiene, reduce allostatic load, and promote positive mood as well as dealing with anxiety and depression. Also, religious meditation can add an extra benefit to it. For example, faith is compared to the placebo effect, where the patient believes a certain pill is going to solve the problem. Some placebo effects can be traced to patients with depression, anxiety, schizophrenia, obsessive compulsive disorder, ischemic heart disease, cardiac failure, Parkinson's disease, and even cancer. One of the studies in the article titled Prayer and Healing, a Medical and Scientific Perspective on randomized controlled trials by Andrade and Radhakrishnan in 2009 showed that pregnant women who had been praying for someone else doubled their rate of pregnancy for that woman compared to those who had not been praying for. On the other hand, praying did not influence positive outcomes. For example, in one study, but the same article found that those patients recovering from coronary artery graft surgery being prayed for didn't have better outcomes than those who weren't prayed for the contrary. And for the contrary, those who were prayed for had even more complications than those that weren't. Some ethical and cultural considerations for treating patients with prayer and or meditation should be first questioning the patients if the patient what are the patient's religious affiliations, the familiarity about these two modalities, um, and whether or not to practice these two therapies if the patient that is if the patient is open to um, give a try to any of these two. And my own opinion about this topic is that the healing effects with either prayer or meditation are questionable by science. Nevertheless, these two help by easing symptoms and or disorders such as chronic pain, depression, anxiety, stress, blood pressure. Also promote positive mood and awareness, as I mentioned before. Um, I tend to use meditation in my daily life, so I can treat my own anxiety and reduce my stress level. And as a byproduct of this practice, I get to feel more aware of my surroundings, be more present in the moment, and have my mind at ease. Um, Truly, distant prayer or even prayer is challenging to be quantified in studies, whether or not is effective in the healing process of patients. However, it's undeniable that prayer and meditation offer a placebo effect for some patients and help them in their recovery journey.